family mode.
Welcome to the seminar, Suicide Prevention for Teens. Hi, I'm Karen McKelvey. I'm the Director of PSI's Professional Development Services, as well as Director of Prevention Intervention Services. The incidence of youth suicide continues to rise and is now, sadly, the second leading cause of injury death among youth in Ohio. This is an issue that affects all of us. PSI staff works with hundreds of students daily in our roles as school psychologists, counselors, school health personnel, educational specialists, and speech therapists. And we all feel it is vitally important to support our partner schools and other educators by providing cutting-edge expertise in response to this sometimes overwhelming problem. PSI also has a crisis intervention team to serve our partner schools, and we were fortunate to have been trained by today's presenter, Dr. Scott Poland. Our goal and our hope for you and for our staff and partner schools is never to need to respond to your school in the aftermath of a student's suicide. Our main presenter today, Scott Poland, is a PSI expert partner and a premier authority on school safety and violence prevention. He personally responded in the aftermath of 13 school shootings and has authored several books and articles on school safety, school violence, suicide, and bullying. His most recent book actually is Suicide in Schools, A Practitioner's Guide to Multi-Level Prevention, Assessment, Intervention, and Postvention. During this presentation, the audience will be electronically muted. During the presentation, if you have questions, use the chat function to submit them. You can use that much like an instant message on the right-hand side there of your screen. Just type them in. Dr. Poland will answer as many as possible in the time allotted at the end. And those that are not answered can be answered later by Scott Poland, and we will post this on the PSI website. We are recording this presentation for those who couldn't register or attend. PSI's contact information will be on the last slide, as will Dr. Poland's. After Dr. Poland finishes his part, I will be explaining PSI's wonderful partnership with an amazing organization, Life Act, and the way that you can bring suicide prevention education to your school. And now, on behalf of all of us at PSI, I am so pleased to present Dr. Scott Poland.
Thank you very much, Karen. And again, it's a pleasure to work with PSI and your many outstanding prevention programs. And I'm excited about you bringing Life Act to many schools in Ohio. As you know, depression is a major problem for young people. And basically, we have some statistics about the incidence of depression, and I have been very conservative. 5%, think of it this way, 5% at any given time of the students in the classroom, 1 in 20 would be suffering from depression. Research actually says during adolescence, perhaps as many as 20% or 1 in 5 students suffer from depression at some point during the adolescent years. So it's very common. Yet sadly, as we talk a little more about it, unfortunately, most of the time our teens suffering from depression do not receive any treatment. And I work in a university today, and at the university there's a lot of concern that young people coming in to undergraduate programs are bringing a myriad of mental health problems and much greater mental health problems than ever before. And yes, females tend to suffer from depression more than males do. But I want to look at what I think would be a fairly typical example of a 14-year-old, could still be in 8th grade, might be now in the 9th grade, depending when that birthday fell. Previously had good grades, now is failing a couple of classes. Our parents feel like she's sleeping more than ever before, and she's really isolating herself from the family, spending lots of time in her room. Oh, and she had loved dance and had participated in dance for years, but now she didn't want to participate this year. And her English teacher is aware of themes of sadness. And by the way, I still remember the first suicidal poem that I was handed one day too late by an English teacher. And I could, if we had time, recite it to you by heart. But 32 years later, that English teacher wishes she'd have sat down with her. She'd have asked, are these your thoughts? This worries me. You're not the first person to feel this way. There is help available. I'm going to get you help. And there are some factors about teen depression that are clearly misunderstood in our society, that, oh, there's something wrong with the teen. They're just not motivated. They can't just kind of seem to tough it up and get through it. Or often in our schools and families, we're thinking, oh, this is just typical teenage behavior. They withdraw. Sometimes it's even like, well, they know they're going away to college next year. They're trying to prepare me by being really difficult, so I won't miss them quite as much. Or they're going through some kind of a phase. And in reality, there are a couple of key words that I'll emphasize today. Persistence. Is this something that has gone on over several weeks, 2 or 3 weeks or more? Is it pervasive? Is it affecting all aspects of their life? School, social relationships, family, and another word beginning with the P is very important. Pleasureful. They've dropped out of pleasureful activities. As I just went over, Kayla had loved dance. Now all of a sudden, she doesn't want to participate. And unfortunately, there's a lot of stigma to getting help. Sometimes parents feel like, oh, they're going to think that I'm not a good parent. That's why my child has a problem with mental health. And teenagers' depression doesn't look exactly like adult depression. And problems with teenage depression, and especially suicide for teenagers, peaks in the late spring, May and June, not the holiday time in Christmas as most people think. And unfortunately, many people view medication negatively. There are states in this country that have really made it difficult for even well-trained, knowledgeable school staff to talk with parents about needed medication. And then we'll talk about the Black Diamond warning at some point in the future. So here are some of the most common characteristics of a depressed teen. They're irritable, they're angry, they have somatic complaints, they may be in the nurse's office a lot, they may develop some problems with absenteeism that were never there before, they're overly sensitive to even the littlest slight or criticism, and they start pulling away from family members and school activities and maybe even the friends they've had. All of a sudden they're interacting with a whole different crowd. And teen depression actually often clusters with other symptoms. And it's really important that we realize teen depression can affect everyone. There was a suicide of actually she was a Penn freshman. She died by suicide last year. And apparently her last name was Holleran. I believe it was Madison or Megan Holleran. But there was actually an ESPN feature about her because she was a superstar. Her team won multiple state championships. She was a beautiful girl. She was smart. She had a scholarship to Penn. But her dad had a really telling and important statement. He says, it doesn't matter how popular, smart, how successful you might be, how many friends you have, you can still suffer from depression. And what we know is more and more research is talking about a biological basis to depression, and there being neurotransmitters involved, and the levels of serotonin and norepinephrine play a role. And this is all the more reason to get a depressed teenager to a physician, to a psychologist. And the best combination is medication and therapy at the same time. So as I was talking about earlier, the depression could be a part of a bigger picture. There could be attention deficit disorder. There could be problems with anxiety. There could be conduct problems. And an evaluation is going to clearly sort that out. And the estimates are that 80% of depressed teenagers will benefit, and really benefit greatly, from our known proven treatments. And once the treatments begin, there's a dramatic decrease in the number of suicide attempts and suicidal thoughts. And that depression can be so severe that it interferes with an ability to function in all areas. That's why I was talking about family, social relationships, and school performance. And again, we're looking for symptoms that have persisted over a several-week period that affect mood. There may be physical symptoms, as I mentioned, and certainly it affects their attitude about their thoughts of being capable and being a problem solver and being able to roll with it, whatever comes along. And in our schools, we have to know the best sources of assistance in our community. We need to know what our school counselor, social worker, psychologist could reasonably do, and then where's the best treatment available in our community. And we need to be persuasive in presenting the issues to parents. And I presented yesterday here in Florida, and I was honest, and I said, probably maybe 2 out of every 10 times when I use my best side manner to try to convince parents, I'm a school person, I know there's a problem, you need to get help. Unfortunately, only about 20% of the time did the parents actually follow through. And it's important that we make follow-up calls. And maybe the follow-up call, have you made that appointment? How's your child doing? Maybe that follow-up call would actually spur parents to follow through with those recommendations. And then a frustration that I've also experienced, as I'm sure many PSI staff have, is when we know that a student used to be on medication, but the medication was stopped without ever even giving the physician the courtesy of letting them know what your concerns might be. There are a number of effective medications, and if one doesn't work, then let's try another one. So here are the most common ones in the SSRI category. Most common are Prozac, Zoloft, Paxil, Luvox, and Celexa. And actually earlier this morning I was talking with one of the true giants in this field, Dr. Thomas Joyner, and I asked him what he thought about the black diamond warning on the antidepressant boxes. And basically he said what I expected he would say, because he's written about it, and I also believe strongly that warning has resulted in many fewer adolescents receiving needed medical interventions. And that warning has actually resulted in the deaths of many young people because their families were so opposed to the medication. And if anything, that warning from the Federal Drug Administration was really overemphasized what had been minimal problems in the drug trials. So, and what would we want parents to do? Talk to the physician. Let the physician explain thoroughly what these medications do or do not do, and ask the physicians about the warning and what they think about it. Because most teens who take those medications immediately or within a short period of time experienced welcome relief. And of course, obviously, we want to monitor teens on depression very carefully. And more about that in just a moment. So we want school personnel and parents to really be there to listen to teens that are experiencing signs of depression. And to be honest, in my work, too often in the schools, we dismiss the statements a teen is making, or we try to give them a little pep talk, or we really are wanting them to snap out of it. In reality, we need to be empathetic, we need to be a good listener, validate their feelings, and think about what we might be able to do in our classrooms and our families to reduce some of the pressure that's causing the teen stress. And what can we do to model for them, of course, positive mental health, the benefits of exercise, getting the right amount of sleep, proper nutrition. And the sleep issue is really an interesting one. Yesterday, I was in a school, a high school, that begins at 7:05 in the morning. In reality, that is madness. All of the research says teenagers are chronically sleep deprived. They are not ready to get up early in the morning. They are not wired to go to bed early, no matter how much their parents might try. And I was involved in responding to 2 suicide clusters last year, Fairfax County, Virginia, and another one in Palo Alto, California. And Fairfax County recognized that sleep deprivation can lead to hopelessness and depression for teenagers, and nobody starts high school before 8:30 in the morning in Fairfax County, Virginia. That's the 10th largest district in the nation. I very much hope they start a trend. And in Palo Alto, I was asked, what do you think about the fact that many parents want their high school kid in 0 hour? They can come an hour before everybody else and pack another advanced placement class into their schedule. Well, first of all, that's going to add a whole lot more stress and pressure because those AB classes require a lot of work, but it's also going to cost their child sleep. So I was totally opposed to that. So back to the physicians for a moment. Weekly meeting with the physician if a child starts on medication for at least the first month. And if there's any concern at all, then that needs to continue every week. If not, it could go to every other week. Problems, concerns, get your child back to the physician. More tips that are really, this is labeled parents, but it's important that school personnel think of the support they can provide as well. We do know that depression can tend to run in families, and what we really need families to do is to be honest with school personnel. When we have the interview, we have the conference, it really helps if they acknowledge that yes, there's been a history of depression in our family. And the other thing that's really important is when school personnel know that a child is receiving treatment out in the community from a private practitioner, we need a release of information. And what I've learned over the years, it's not enough to just ask. We need to be persuasive in asking for that release of information. We need to explain, this is how we're going to be able to help your child the best. And we will keep information we receive from the private practitioner confidential. So we need a collaboration between parents, schools, and any treatment providers in the community. And I worked on a plan for the state of Texas schools that just was completed for this fall, and it's available. It's available at texassuicideprevention.org. But what I recommended in that plan was an annual in-service for all school personnel every year about warning signs of depression and suicide. And yesterday, with school psychologists from 2 counties in Florida, I asked, what happens if you go to your district website right now and you search depression and suicide? Is there anything there to guide parents, to let them know who to call in the school, to help them know what some of those warning signs might be? And of course, in our schools, students that are depressed need to be intervened with individually. And again, the important points about don't hesitate to make referrals, follow up, know the best sources of assistance in your community, and be honest and open in conferences with teenagers and their parents about what the school can do, what's available in the community, and share things like 80% of the time the treatment is very effective in reducing teenage depression. And at the simplest level, what I would like to see schools do, and PSI would be a wonderful partner with this, but create a task force on teen depression and suicide, investigate, decide, and implement some of these strategies, and implement programs like Life Act, and really become advocates in your school and community to identify teenagers that are suffering and get them the help that they need. And then in our curriculum, particularly in high school classes like psychology or social problems and health, we need very well-designed units that would help young people identify signs and symptoms of mental health problems, and especially depression. So here are another slide on symptoms, and these are pretty straightforward. We've talked about most of these, but let's highlight crying that seems unexplainable and excessive, that irritability. You say one thing to them as a teacher and they snap back at you, and then these behavioral changes of withdrawing from friends, and again that important point about dropping out of what have previously been very joyful and pleasurable activities, and then the changes in the eating and sleeping habits. So we've talked about the somatic complaints, increase in visits to the school nurse, or maybe going to see their physician. And what we really need is a society where all of the physicians are tuned in to the problem of teen depression and suicide. There was actually a national recommendation that came out 6 years ago. It said every teenager seeing the doctor for any reason should fill out a little short questionnaire about energy level, joy of life, thoughts of depression, and that doctor's office should score it before the kid walks out at the end of the appointment. Unfortunately, that is not being done by very few physicians in this country. That depression could also manifest itself in schoolwork and having problems completing assignments, not being able to concentrate. So we might see a real dip in their school performance. And then very importantly, one of the things I said yesterday, what's the real problem? Most of the time, all of our prevention efforts are simply talking with the adults, never with the students. That's what's so important about Life Act. It's going to be in classrooms. It's going to talk to students about stress and management of stress. And wouldn't it be wonderful if, like every teenager in America, had some idea what to do if their friend is talking about feeling hopeless, feeling worthless, not wanting to go on. So we need to help the friends know what to do. And by the way, alcohol is a depressant. If somebody is depressed, feeling really low, getting drunk is not going to help. They're going to get lower than they were before they started drinking. So we need the teens themselves to know some of these warning signs, and in particular, if somebody talks about hopelessness, death, and dying, do not hesitate. Get help for your friends. Know numbers like 1-800-SUICIDE. And one of the things that I think is important for all teens to know, so many of them have Apple phones. You hold down the button, you talk to Siri, and you say, I'm depressed, or I'm thinking about killing myself. I want to know where the nearest bridge is. Siri is going to say, may I connect you with the National Crisis Helpline? It sounds like you are depressed. I can connect you with resources right now. And then on the screen, all you have to do is push a button and you're talking to the National Crisis Helpline. very important thing for all of our young people to know. And then, yes, there is a relationship between bullying and depression, and a relationship between bullying and suicide. And the very children that are anxious and depressed in our schools are very likely to be the targets of bullying. And we also know that bullying, the research has shown, has an impact, maybe even for decades, on students' feelings of self-worth. So when we know somebody is the victim of bullying, our school staff need to sit down with them and talk with them and look for signs of depression and not be afraid to ask them directly, are you depressed? Are you thinking of giving up? Are you even thinking that you don't want to live anymore? So very important that we talk directly. And please know that we're never going to plant the idea of suicide in a kid's head. In fact, one of the people I admire a great deal, his name is Clark Flatt. He lost his son Jason to suicide. He started the Jason Foundation, which has really been behind legislation for suicide prevention in schools now in 15 states. And Clark says, our teenagers, they're wondering why the adults aren't talking with them about depression and suicide, because their friends are talking to them about it, and they're wondering, why don't the adults weigh in and give us good information? And of course, the greatest concern and the thing that is stopping the adults from having dialogue about depression and suicide is many adults unfortunately believe somehow we're going to plant the idea in their head. And let me quote our Surgeon General. More than 40,000 suicides a year in this country. We need to talk about it more in our homes, our neighborhoods, our schools, and our churches. So really, the problem is so extensive because we haven't talked about it with our young people in terms of what to do, how to help yourself, how to help your friends. And today in a conference, they didn't use the word means restriction, they called it means safety. And the bottom line is, you take away the method, very unlikely that a suicide is going to occur. You remove the gun, you do things like put barriers on bridges. Worldwide, means restriction and means safety has saved lives. And perhaps the simplest way to think about youth suicide, untreated mental health problems, probably 90% of the time, that mental health problem was untreated depression. There's the survey nationally, and you can find the data by the state of Ohio. And let's just glance at the bottom statistic there. So let's say we have a high school of 1,000 students. 8%, based on our best available data, made a suicide attempt in the last 12 months. So who is the most likely to make an attempt tomorrow? That would, of course, be the kid that has the history of suicidal behavior. So 8% of a high school of 1,000, that would be 80. You know what's really scary about that statistic? I'm going to argue for the most part, the staff in that high school have no idea about those suicide attempts. The parents of the students who made the attempts, rarely are they aware of them. So who knows about the suicide attempts? That would always be their friends. And that's why it is so important that we reach friends through programs like Life Act. So moving on, there is the slide about the Prevention Task Force recommendation from 2009. And these screenings need to be repeated. And wouldn't it be wonderful if this task force that I am promoting and describing would include a member of the medical community? So In August, I was the keynote speaker at the Texas State Suicide Prevention Symposium. There were 900 people that heard me talk. I asked, how many of you are physicians? One hand out of 900 went up. So we have to get the medical community more involved, and the literature well documents 70% of the time, the person, regardless of the age, who died by suicide actually went to see their doctor not long before they ended their life. So school personnel have opportunities to prevent suicide, and certainly physicians do as well. So I know that Karen is going to talk a little more about Life Act in a few minutes, so I'm going to go past this slide except to say I'm excited about the program and PSI's partnership. Now I want to talk about another program, and I might be the biggest supporter of this program in the country. I started working on youth suicide prevention 33 years ago, and I've responded to countless tragic youth suicides. Here is the most promising thing to come along in decades are the programs that actually talk to the teenagers themselves. SOS, which is Signs of Suicide. More information is available at mentalhealthscreening.org. I'm on their advisory board. I did a webinar for them last year. I'm going to do a training for them in Boston, which is their headquarters, in November. But what is so important about depression screening? Two key components. The first is the short questionnaire, very much like the one that needs to be filled out in the physician's office. The SOS one actually has 7 questions. The kid turns it over, they score it, and they know immediately whether they need to talk to a mental health professional today. And there's research on this program. It does save lives. It's listed in the Best Practice Registry 1 at the Suicide Prevention Center, which is our federal program and initiative to prevent suicide. And then I love the SOS video. The SOS video vignettes. Young people are intervened with, classmates, teachers, family members, get to the bottom of what's going on. And please know that most young people are ambivalent about suicide. One minute I want to kill myself. My life's a series of never-ending problems, none of my making, never getting any better. But a few minutes later, there is a glimmer of hope. Voltaire, in the year 1764, actually said, the young man in the fit of melancholy who died by suicide today might have wanted to live had he merely waited a week. What's the job of the school personnel that are listening in today? Help a student get through a difficult afternoon, a difficult week, and they are probably going to want to live. And just before the webinar started, I was reading a book about the Golden Gate Bridge, the single place in the world where the most suicides have occurred. Unfortunately, only about 2% of the people who jump actually survive. And they say things like this. The moment I jumped, I realized all the problems that I thought were totally unfixable were actually fixable, and I prayed that I might survive. We just have to get our young people through some difficult times, and we all have to know these warning signs, which will be a big part of the Life Act program. Suicidal notes, reading books about suicide, making threats about suicide, writing about suicide, dramatic changes in behavior, which we talked about, sleeping, weight, and as well as dropping out of activities, giving away prized possessions, things that were really precious to them, and all of a sudden, oh, I want you to have this. Making out a will, fascination with death. And unfortunately, when a suicide does occur. It's like taking a rock and throwing it into a pond, the ripple effect, the schools, the neighborhoods, the community. And I'm going to argue that ripple effect is greater than ever before today because of social media. Vulnerable young people find each other online, and interventions today can't just be confined to one school because there are all these connections and ripple effects throughout the district and even over to other communities. And yes, we're starting to view engaging in self-injurious behaviors like cutting, which is the most common, scratching, burning. We're starting to view those as almost a gateway to suicide, as a habituation, as young people learn and progress and become comfortable with the idea of harming themselves as they habituate to it. So if you know a teen that you think might be depressed, obviously I'm recommending someone like a school counselor, social worker, psychologist sit down with them. I'm recommending that a teacher express some concern, reach out, and hopefully escort the student into seeing the professional. And I want to give an example from my wife was a longtime principal, recently retired. There was a lot of talk that a student at the middle school was suicidal. And my wife went to the counselor. Counselor was asked to check into it. Several hours passed, and my wife goes to seek out the counselor. Well, what'd you find out? Is the student suicidal, as we've heard? The counselor is, oh, I haven't gotten to that as yet. And I want to really stress the immediacy of reaching out to these teenagers. And really, if we can help them understand that, yes, there are often biological and genetic factors that are involved. And sometimes it can be some kind of major life event that is really bringing out the depression and the response to a grievous loss or trauma in the family or a divorce or even a breakup of a romantic relationship. I'm afraid most adults in our schools would be prone to saying something like, oh, it's going to be okay. Let me talk to you about what happened to me when I was 14. And I'm fine today. And it's really, we should be saying things like, this is hard for you. You're not sure. Are you worried you'll never have another significant relationship? So we truly need to reach out to them, not preach. And as I said earlier, the most effective treatments involve therapy. And of course, the challenge in our schools is, well, who's a good provider? Who might be on the family's insurance program? Oh, wait a minute, they don't have insurance. Who has a sliding scale? And this is why I believe so strongly we do need to increase our mental health professionals in schools like counselors, social workers, psychologists. And where I used to be the director, we actually started a therapy clinic in the evening for students and their families that simply did not have the resources to go out into the community, those low-income families. And that I retired 10 years ago. That therapy clinic is still going in the evenings. I'd be remiss today not to just spend a few minutes talking about arguably the biggest word in all of psychology, which is resiliency. It is a learned behavior. It's the ability to bounce back. It's the ability to deal with adversity. And some of the things that are going to help a depressed teen are to be surrounded by caring family and friends, to have good problem-solving skills, and to realize although they're down right now and sad, they need to have some optimism about the future. And they need those opportunities to vent strong emotions in the therapy and counseling that I am recommending. Here are the protective factors from the World Health Organization. And boy, would I like to think that these are in place for every teenager in America, but unfortunately, often they are missing. Having a good relationship with other young people. But you know, I asked my group yesterday, who does a disturbed teenager turn to? Typically, they turn to another disturbed teenager. And between 2 or 3 of them, they don't have enough sense to get an adult involved. And we need to be talking to them all the time about, yes, I believe in friendships. Yes, I believe in confidence. But if something is really wrong, something is dangerous, something is truly life-threatening, we have to get an adult involved. And the adults have to be approachable. The whole thing is at school, if you don't have a significant relationship with any of the adults at school, you're unlikely to go to them, either to get help for yourself or help for your friends. And then earlier I talked about what's called restricting the means. And sadly, the most common method of suicide in America, even for our young people, is a gun. And if somebody ever tells parents you have a troubled, impulsive, depressed, substance abusing young person with mental health problems and primarily emphasize that depression, please don't keep a gun available to them. We have already talked about access to mental health care. We need a lot more of it in our schools. Religion is a wonderful protective factor, whether it's the church, whether it's the synagogue, whether it's the mosque. It's a place to connect and belong. And an early prevalent theory of suicide by a guy named Durkheim, he had the word anonymy, basically emphasizing that when a young person dies by suicide, it was the social isolation. We should all feel a sense of failure because we didn't have the connectedness and community that all kids need. And obviously we want that school environment to promote health and well-being and really focus on what's called social and emotional learning. And some of these school districts that have experienced these tragic suicide clusters, that's become a big focus. How do we increase the belonging? How do we put more emphasis on their social and emotional well-being and not quite so much emphasis on their state test scores? And obviously we want cohesion and stability in our families. And somehow I doubt I'm the only person listening that experienced a divorce. You know what really helped? My ex-wife is a psychologist. We made a pact. You don't talk badly about me to our children, I won't talk badly about you. And all those milestones, all those events, everybody needs to be there, needs to be nice, and realize the parents are partners forever in raising the children they brought into this world. I think I've made most of these points already in terms of protective factors, but just know it's not Scott Poland is saying these things. They're coming from the World Health Organization. It's aware of more than 1 million suicides around the world nationally. Teen depression is treatable. Teen suicide is preventable. Here are a couple of resources for you. The Suicide Prevention Resource Center, as I mentioned, the Science of Suicide program. At our website here at the university, we had a federal grant. We used our grant to expand what we were already doing. We have original videos, suicide awareness, suicide assessment, suicide postvention, and also a video that I did for the state of Florida on self-injury, insight and testimony. And probably the most important point for me to say about that video is I interviewed 2 young women who give incredible insight into their struggle with self-injury, how they overcame it, what their parents did or didn't do, what did the school do, what treatment worked, what approach didn't work. And I think the audience of PSI would find it very, very helpful. And then I'd like to basically say just a couple more things. And before I turn it back to Karen, I'd like to give a success story. And I imagine that many of you listening have been involved in stories like these. The young man moved into our school district. His mom and stepdad divorced. He wasn't happy about that. He loved his stepdad. He went to live with his dad, who he hadn't lived with until he was about 3 when the parents divorced. And now he's 16 years old. He's in a large high school. He meets a girl. I'm going to call him Tom. I'm going to call her Cheryl. Tom put a lot of emphasis on that relationship. He and Cheryl start going together. For a while, things are okay. He's living with Dad. He is passing his assignments in school. He gets a job. He buys a truck. He's working after school. But he'd had a problem with substance abuse, and that came back. Cheryl tried to tell him, I won't have a boyfriend that engages in substance abuse. One day, Tom skipped work to get high. Somehow the employer found out about it and fired him. Tom has now bounced some checks. He can't pay for the repairs on his truck, and all of a sudden he's failing many of his subjects, but Dad didn't know. He didn't even know when to look for the report card. Cheryl breaks up with him on a Sunday night. Tom takes all the aspirin that are in the bottle. The next morning, lucky for Tom, he's alive. His dad said to me after I met him, I said to Tom, are you sick? You're throwing up. Can I help you? Can I take you to the doctor? Want me to stay home with you? Tom said, no, Dad, I'm okay. I'll go to school. But over the course of the next couple of days, Tom really isn't in his classes. He's driving recklessly. He's drinking heavily. He's not taking pride in appearance. Cheryl is really worried. She can't quite put her finger on it. But on Thursday, she feels compelled to go open up his locker. She has the combination. You could say it was sheer luck. It was divine intervention. It was premonition. We'll never know. But she finds the suicide note. The goodbye note is addressed to her, telling her he's going to kill himself, and it's not her fault. Now here's what most kids do with that information. They hesitate. They think, I'll call him later. I'm sure he wouldn't do that, but I'll check on him later. Cheryl doesn't hesitate. She goes right into the counseling office. The counselors are busy. She doesn't sit down and take the number. Bam, bam, bam on the door. I need help. I need it now. Counselor sees the panic on her face, reads the note. Now they're in the principal's office. He says, sit here. We're going to search the school. He's nowhere to be found. Now that principal could have said, oh, we'll check on it tomorrow. Instead, he turns to her and says, you must know where he lives. You do? Come with me now. Turned to an assistant and said, call the dad. Tell him to meet us at his home. I was one of the people that was called, and I think we actually arrived maybe only a few minutes after Tom did. And he said something like this. I went home to get the gun. I was going to finish the whiskey, then I was going to kill myself. I don't know if he would have or not, but a lot of very dangerous elements were present. So what was the outcome? Yes, he went into a hospital for 2 weeks. He got outpatient counseling for some months. And by the way, he never got back together with Cheryl, but he thanked her. And by the way, how did she know what to do? They had talked about it in her 10th grade health class. Programs like Life Act that talk about the importance of taking action to save a life. Now we went back to my old district because they actually named schools after people, and one of the people being so honored was important to my wife and I. And across the room, after more than a decade, I saw his counselor, Donnie Sue. And I rushed over to her and I said, Donnie Sue, you've got to remember that kid Tom. I mean, what happened to him? Do you know? And she's like, funny you would ask that, Scott. I actually saw him in the grocery store a couple weeks ago. He's married, got a good job. He has two of the cutest little girls in the world. And by the way, what would he say if we called him up today? You think he'd tell you his life was wonderful? I doubt it. He'd simply say, I'm glad to be alive. And the intervention of any one person, any staff member in the schools in Ohio, any PSI person, probably most importantly, the intervention of any student who knows enough to get help for their friends. And one more analogy. Imagine we have a teenager that's fallen in a deep, dark hole, and along comes a member of the clergy. They say a few prayers for them. They toss a few rosary beads. They go on. Along comes a physician. The physician tosses down a prescription. They move on. Along comes a good friend who jumps down in the hole with them. And the distraught teen says, why are you down here with me? And his friend said, I know the way out. I know where we can go for help. I know where we can make sure you know who to talk to, who to call, and to get you the help you need, and come with me now. That's what we need in our schools and our communities, and I'll turn it back to Karen. Thank you for listening.
Thank you so much, Scott. What I would like to do now is talk a little bit about the connection between PSI and Life Act and share with you both some particulars on the Life Act programs, but also in regard to how it will work with PSI being chosen as Life Act's educational partner. Just some basics about Life Act. They do have two programs. I'll start here with the middle school program, which is aimed particularly for seventh graders, and it's called You Are Okay, or You Rock. And it was developed at Case Western Reserve University, and after that was vetted at the UH department, University Hospitals Department of Child and Adolescent Psychiatry. But the wonderful thing is that it was specifically written for middle school students, which makes it unique in regard to many of the programs that are out there. I love it very much in regard to the fact that it's very prevention focused. It helps the seventh graders begin to understand, well, what is stress? How does that lead to depression? Middle schoolers are able to begin to identify their own areas of stress. We talk about the very particular things that begin to take place in middle school and give them ideas how to not only identify, but begin to manage it in a healthy way. So they're taught to do all of those things, and ultimately, at the end of the program, they learn how to ask for help and to find that particular trusted adult that they need to find. It is a 2-day presentation or a 2-part presentation. I think it works best if it's done in 2 different days, and each of the segments is about 45 minutes. So it's written so that it will fit nicely into a school's already set up class schedule. So there's a PowerPoint, there are videos, some group activities and discussion, but it's all focused on those age-relevant things that a seventh grader might experience. It's so important for you to know that there are several tactics that are used where kids are filling out cards and self-disclosing, and any of those that we feel are self-identifying, we are able to immediately get them some help. Oftentimes, the comforting thought to me is that the staff that is in the school is actually a PSI school psychologist or counselor, but even if that's not the case, we ask for the involvement of the school guidance counselors or psychologist staff. So the instructors will record anything in regard to something that's self-identifying. So we make sure the kids get help. We don't just come in and talk to the kids and leave. So the program beyond the middle school program is one that Life Act has been doing for many years. They had a high school program initially. I'm sorry, we're having a little bit of technical glitching here. So the high school program is called Recognizing Teen Depression and Preventing Suicide. Again, it's written specifically for high schoolers. It was just recently completely redone and updated. So that's another thing Life Act does a great job with, is to keeping it relevant and updated. As you can see there, there's early identification and intervention for teens that self-disclose. And again, the teens are taught about depression and warning signs and learning how to identify. So some of the basics are the way the PSI is able to begin to offer this to schools is the fact that there are quite many generous people out there, donors, foundations, grants. Life Act does its own fundraising as well. And the program then can come to your school at no cost to your school. And that's through this generous group of people. This particular year, PSI is beginning to conduct needs assessments to see if your school is interested. We have had quite an overwhelming response to the surveys that we've been sending out. So we're working diligently to focusing right now on Northeast Ohio schools, but we are looking to expand along with Life Act continuously as we expand through Ohio and continuously expand this program over the next several years. If your school is interested, feel free. There's my email address there to reach out to me. I can get you the help that you might need, or at least get you in the right loop. As I said, PSI is doing the middle school program, but I can certainly connect you with the folks at Life Act who are doing the high school program. If you still have your original email that you received, there's a link right in that email that takes you to that registration link. There's the actual website there. It's a little complicated to try to write down, but go back to your initial email blast that you received, and there's a link there to sign up or ask for further information. We'll be happy to send that to you. So I do want to thank you so much for joining Life Act and PSI and Scott Poland in this amazing and vital mission. There's some websites there, the PSI website and the Life Act one as well. That has brought us to the end of our webinar. I do want you to know that we will be posting, there were some questions that came in, we will be posting the slides and a recording of this webinar. It will give us about a week. You'll actually get an email telling you that it's ready to go if you want to look at it again. At the end of this, within a day, you will be sent an email that will give you a survey. Those of you who are listening right now, you fill out that survey and send it in, and then you will be able to get a certificate of a contact hour for having participated in this webinar. We certainly hope that you found this useful. I'm going to try to squeeze in one other question that came in. And maybe, Scott, you can try to answer this in the minute we have left. It's a very important question and one that I'm also curious about. Scott, what are the biggest obstacles to getting schools to sign up for programs such as Life Act? Why are there obstacles?
Well, unfortunately, most of the time it does take a suicide that affects a school, sometimes even 2 or 3, to really get the attention of the administration. Unfortunately, most administrators are really not very knowledgeable about suicide prevention, intervention. It really isn't a part of their coursework. They tend to be uncomfortable with the topic. And what we really need, and I said this yesterday, suicide prevention can't be a site-based issue where one principal opts in, another one opts out. It really needs to come from the school board and the superintendent. And the decisions that are made by administration need to be based on knowledge. And you mentioned, sadly, suicide is the second leading cause of death for young people in Ohio. But once you acknowledge that, it would seem like you would want to realize schools have a part to play here. Schools don't have the only role, but let's be honest, kids are in a school a major part of the day. So schools need to have programs like Life Act, and they need to network and collaborate with agencies, community and state initiatives. And I'm especially excited that Life Act focuses on the middle school population as well as the high school. We know that the suicide rate for middle schoolers has increased the most dramatically in the last decade. And if we can help kids in the middle school learn to manage stress, know how to help themselves and each other, that's really a skill that they can utilize across their lifespan. That's what is so important.
Okay, thank you so much, Scott. And thank you to all of you who participated. We hope you found this useful and important information. And you will be receiving an email soon with your survey and certificate information. And again, it will be recorded. The recording will be posted on the PSI website. Thank you so much.